everyone, and welcome to Impact St. Louis's fall panel on COVID-19, long-term and aftermath. Together we will spend the next 90 minutes, or I guess now 80 minutes, hearing from experts across the St. Louis and Missouri regions who will share their unique insight into how COVID is affecting our lives today and communicate immediate and collaborative actions that will hopefully further engage our audience as we all work to bring the pandemic to an end. At any point during the discussion, we encourage you as the audience to please participate by either posing questions or sharing your ideas. So just raise your hand and we'll call on you and you can just ask as the panel goes along. So over the last year, the COVID-19 pandemic has, as you all know, devastated communities, exacerbated existing healthcare disparities, and changed fundamental aspects of our daily lives. Although the COVID-19 vaccine is considered by many to be the optimal path to return society to a sense of normalcy, widespread misinformation and political agendas have posed significant threats to vaccine distribution and compliance. Additionally, the spread of variants and increasing COVID-19 incidence rates amongst vaccinated individuals have further called the efficacy of the vaccine into question in a time where improvements in vaccination rates are desperately needed. As the months continue to go by with no end in sight, many are wondering when the pandemic may finally reach its highly anticipated end, as well as the steps we will have to take to accelerate our progression towards a COVID-19 free, or probably more likely immune, society. So now I'm honored to formally welcome our 4 panelists who will help expand on the current issues surrounding COVID-19 by sharing their valuable work and unique insight with us this evening. So I'm going to give a brief introduction, and then the panelists, you are just free to sort of elaborate and share any other additional information about yourself that you would like to our audience. So first we welcome Angela Clavin. Sorry if I mispronounce anything also. Ms. Clavin is the CEO of Care St. Louis Health, a network of federally qualified health centers focused on meeting the needs of underserved communities right here in the St. Louis region. Ms. Clavin is a passionate advocate for healthcare equity and serves as a board member for several equity promoting organizations, such as Missouri Primary Care Association, Missouri Health Plus, St. Louis Integrated Health Network, and the St. Louis Regional Health Commission. So, welcome, Ms. Clavin.
Good evening, everyone. Thank you for having me. As she mentioned, I'm Angela Clavin. I am the CEO of CareSTL Health. I work for CareSTL Health. It's a federally qualified health center. What that means is an organization. We're not a federal government organization, but we receive federal funds to provide care to the uninsured and underinsured for us in North St. Louis City and County. I have been working for FQAC for 40 years. I started out as a registration clerk, and I moved my way up to the CEO. My background is accounting and finance. I'm on the administrative side. But one big issue for the COVID initiative for federally qualified health centers for us is that the federal government, the state of Missouri, and the city of St. Louis have provided funds for us to vaccinate our communities. And for us, North St. Louis, we are not performing well, and we have very difficult times. But that's our job and our task, to educate and vaccinate.
Awesome. So next is Dr. Yusuf Scoggin. He is the Director of the Department of Health Services for the City of St. Louis. Dr. Scoggin's work focuses on the development of human capital through sustainable holistic systems and partnerships. His service to others continues through his position as a board member of organizations such as United Way of Greater St. Louis, St. Louis Mental Health Board, St. Louis Area Regional Commission on Homelessness, the Behavioral Health Network Adult Advisory Board, and many more. He holds a Bachelor's of Science degree from Xavier University of Louisiana and a Doctorate of Medicine from the University of Missouri Columbia School of Medicine. So welcome, Dr. Scoggin.
Sorry, everybody vaccinated in here?
Yes.
So yeah, thanks for the opportunity to share about how we have been able to respond to the COVID pandemic throughout this last 18 or more months. I am now day 9. You're catching me on my new role with the city of St. Louis. 10 days ago, I was working for St. Louis County as the director of the Office of Family and Community Services. And in that role, we were deeply involved in addressing the needs of the most vulnerable in our community. In fact, in the region, projects included providing quarantine and isolation for any underhoused individual throughout the entire region. That includes St. Charles, city, county, also to Illinois. And so through the many partnerships with the health departments across the region, as well as the hospitals, we're able to get the referrals to the necessary quarantine and isolation sites to ensure that the unhoused had a place to stay at home. How many of you all had the luxury of staying at home during this pandemic in accordance with the local stay-at-home orders? Pretty much everybody in this room has a luxury, right? And so oftentimes these are the blind spots of the most vulnerable in our community that we don't necessarily always take heed to, but it is a necessary evil because we also need to protect shelters and other environments. Without this as an option, we would have likely had many, many more outbreaks throughout the community. And so that's just one of the projects that we've been working on throughout this time.
Amazing. Thank you so much once again for coming to our panel. So next is Dr. Jason Newland. Dr. Newland is a pediatric infectious diseases physician at our very own WashU School of Medicine, or kind of ish, anyways. His research focus is on responsible antibiotic use for hospitalized children and the significant roles antimicrobial stewardship programs can have in children's hospitals. Dr. Newland earned his bachelor's degree from Notre Dame University, a doctor of medicine from the University of Oklahoma College of Medicine, and a master's in education from the University of Cincinnati and the Cincinnati Children's Hospital Medical Center. Welcome, Dr. Newland.
Thanks. Thanks for having me to be on this important panel with these wonderful panelists. I'm looking forward to learning as well. As you heard, my day job prior to the pandemic was antibiotic use. When the pandemic happened as an infectious disease person for pediatrics, that has changed dramatically. And one of the biggest things we worked on was with schools. And how has COVID impacted schools, and what should we do within schools to keep COVID transmission low. Through that, and as we've all, and one of the reasons we're here is to discuss the disparities seen within COVID-19 pandemic and how it really showed the black eye of medicine and the things we need to do. But additionally, as I've had the privilege and honor to be a part of the school-based work, we see how school was different among people of color and how that was approached. And that goes, I think, beyond just what COVID-19 has brought up, but there's other, I think, more bigger issues likely underlying that beyond just the pandemic. And we've had I think the opportunity now to do some work within North County schools around COVID-19 testing and how testing might help prevent COVID-19 transmission. There's a lot to be learned and a lot for us to, I think, be better coming out of this pandemic. And I think last I would say we're also involved in some of the vaccine trials. We're currently a site for Moderna, and we're enrolling the younger children. As a matter of fact, that's what our days are like right now. And very excited, though understand we have a lot of challenges ahead to get more people vaccinated. And while we know there's pockets here within North County, there's also pockets in southern Missouri and small towns and throughout, that I'll just be honest, I hate the word vaccine hesitancy, because I think it makes people get defensive when we have a lot of people that are on the vaccine fence, one might say, and they've heard all the misinformation. And everybody has their story, and in all our different groups, and while I know you mentioned that North County hasn't done as well, there are places in West County hasn't done as well. There's places in other parts that haven't done as well. We have work to do throughout.
We have a lot of work to do. Even in the schools, so I'm glad to hear you.
Yeah, no, yes, ma'am.
Yes.
Awesome. Thank you so much once again for coming out. And finally, we welcome Dr. Michael Kinch, who is a professor of biochemistry at, again, WashU School of Medicine, and the Associate Vice Chancellor and Director of the Center for Research, Innovation, and Biotechnology. His work focuses on the practices and processes involved in developing new therapeutic agents and devices, specifically evaluating organizations involved in the clinical trials necessary to gain FDA approval for drugs and devices. His work has further evaluated how these activities have changed over time, as well as the fate of the organizations and individuals that have contributed to an FDA-approved product. Dr. Kinch is the author of 4 published books, including his 2018 work titled Between Hope and Fear, A History of Vaccines and Human Immunity. Dr. Kinch earned his bachelor's degree from The Ohio State University and a PhD in immunology from Duke University. Welcome, Dr. Kinch.
Thank you. I think what I'd like to do is, because someone else has the deep clinical experience, is really to provide the historical background. What I do is to analyze what have been the sources of innovation that have been responsible for the medicines and vaccines that we have. But also, I take sort of the long view of what has been our history, specifically with vaccines. And the book that she mentioned is really about vaccines, and it wasn't intended to be this way, about the fact that with every single vaccine, there has been a parallel rise of an anti-vaccine movement. And what we're experiencing today is nothing new. And so what I think the opportunity and the challenge that we have is how do we learn from that past to address this moving forward, because this pandemic, I believe, can be stopped in its tracks if we get adherence to vaccination and to masks. And so understanding these motivations and also being fully transparent in both what we know and what we do not know will give people greater ease in understanding why vaccination is so important.
Awesome. All right, so thanks once again to all of our panelists. We're now going to move on to the questioning, I guess. Well, not really questioning, that sounds interrogation. Never mind. The interrogation, no. Tell me, no. Okay, so I'm going to start off with a really broad question. I'm going to hand the mic off to you guys, so you guys can just, because you'll be obviously getting it much more than I will. So I'm just going to start off with a super broad question. Feel free to tackle this in any way you want, and throughout the questions that I'm going to give you, some of them will be like more directed to other panels than others, but feel free, please, to like contribute as much or as little as you'd like. It's an open discussion, and I'm very excited to see where this is going to go. So our first question, just really broadly, what are the main factors like pertaining to your sort of field of expertise that are preventing us from fully and effectively ending the COVID-19 pandemic? So take it away. Unless you okay.
It simply boils down to vaccination, in my opinion, as well as these things. And what it comes down to is that people are not resisting vaccines because they're evil. They frankly, and I mean this in a constructive sense, there's a difference between ignorance and stupidity. Stupidity is knowing facts and ignoring them. Ignorance is not being aware of what the proper facts are. And I think the biggest problem that we've got is that the amount of mis and disinformation that's out there is creating a degree of hysteria amongst a portion of the population that is damaging to the story that, look, the vaccines, and I can say we got incredibly lucky in 2020, as miserable of a year as it was, we got incredibly lucky to have an amazingly safe and an amazingly effective vaccine, far more than, as a scientist, we anticipated getting. But we're squandering that, and the fear that I have is that we lose that if we allow certain variants to get a chance to grow out that might ignore the vaccine, or ignore the vaccine in some people, and thereby cause even more death and destruction than they already have.
I have a question. Are there any penalties for spreading misinformation? Because if you shout fire in a movie theater and somebody gets trampled to death, you're sort of liable for that, right? The panic and getting someone hurt.
In the old days, there used to be laws that could support mandates. And vaccine mandates have been around since the 1840s. We've lost that. But I know your question is about the truth, and I think there you get into lots of First Amendment questions. I think one of the most shocking things, and my book on vaccines came out in 2017, long before this happened. At that time, greater than 90% of the anti-vaccine messaging on social media was coming from Russian, Iranian, and North Korean troll farms. And it looked like it was your next door neighbor. And that's part of the danger. And what do those regimes basically share? They want the people of the West to have distrust in their government. They're winning, if not have won. And I don't know whether those percentages hold today, but I would be willing to bet pretty close. And that's something that I think is out there, is even if there were laws, how do you arrest someone sitting in eastern Ukraine?
If misinformation is coming from Fox News, couldn't you just issue a citation and then they do it again, fine them, and they do it a third time, pull their license to broadcast if they're violating public trust?
unfortunately, that's a legal thing, and I have no idea, and as a scientist, I'm staying the heck out of it.
We're glad to hear this information for us, and many of you probably know, being a healthcare provider of over 100 employees, we've been forced to, not forced, but we're required to have all of our employees vaccinated. And those that aren't have to be terminated. And today, last Friday was that day for our staff. A very painful moment for me because I have initially started out with 41 employees that we were going to have to lose, and we were down to 11. And we gave some of the employees their letters, and they still, shared some of the misinformation, some of the just resistant. Part of one misinformation was they were told that if you had COVID, you need to wait 90 days. Then they were told if you did not, if you had it, you can get it. So part of our job is to really provide accurate information in a timely manner. But the other part of it is, especially being a minority, one of my employees who we lost had been with us for over 15 years. And because there was so much misinformation, she truly believed that it was going to go away because on her Facebook page, it really said that come Monday morning, Biden is going to be overthrown and this mandate won't exist. And she showed up for work today. And that was the hardest thing for me because she had been terminated, because it was real. And to lose her job for misinformation, she was so devastated, and I was devastated. Something must be done. So I don't know when it's going to end, but it starts with this misinformation. It is really a hard issue to address, and something must be done. So I don't know the answer, but it's devastating for me.
That's horrible. I mean, I think that's what mandates work in some respects, but you lose some really good people that you cared deeply about. And I think that's, and it's, I think it, I guess I would agree, right, that vaccine's the way out. Is it, are we going to go out? Are we going to get it completely out? I think that's a hard thing to want to answer right now because it doesn't feel like it. And do we have to learn how to live with it? And do we have to accept tens of thousands, hundreds of thousands of people dying every year from a virus that could be preventable because the vaccine's unbelievable. None of us, I mean, if someone would have come up and told me whatever it was, they came and told us a year ago and said that we have a vaccine that's 95% effective, we'd be like, what? Like, we would have taken 60% and done flips on it. And I think that gives us hope. But we tolerate 50 to 75,000 deaths annually from influenza every year. Now, last year we didn't have it, thankfully. Are we going to tolerate that? As a pediatric infectious disease doctor, we tolerate 150 kids dying of influenza every year. Are we going to tolerate 300 or 400? Yes, sir.
So, do you think it's feasible to give COVID vaccines every year or boosters every year, or is that economically not feasible? Because I don't even know how much it costs. I mean, it's free for everyone right now, but in the years to come, will it always be free, or is it something?
I think that there'll be things in place to do that. I think that the question is, are we going to need the boosters on an annual basis, or are we going to, I'll say I'm the first, I went and got my booster because I'm doing a bunch of COVID tests in the house because I feel like that's good. That you could make the argument that you don't need the booster. It's doing exactly what we wanted it to do, which is to prevent people from getting in the hospital and dying. It's exactly done that. Now there are people that are at risk that potentially are vaccinated, that have immune systems that don't work as well. So therefore, the people around them need to be vaccinated. Hence why I'm doing backflips and all any kind of flips I can do because of the 5 to 11-year-olds being approved. And likely in about 2 to 3 days, we could start vaccinating that age group. So it's super important. So, vaccination. Sure.
Sorry, one more follow-up question.
Yes, sir.
So, I've heard people that had COVID and then were immunized have super immunity. Is that true?
No. Super immunity is an interesting comment. It's hard to say that,
They
but
have broadly protective antibodies.
let's put it this way: that being vaccinated and having natural infection, that natural infection is like a booster.
That's what I'm hoping.
Yeah. So it does. in talking to some of the experts that have been involved in the vaccine development and vaccine, immune responses, as a matter of fact, I was talking to a buddy of mine who's doing vaccine trials who got infected back in March of 2020, right at the beginning. He's been vaccinated. He's like, I said, "Are you gonna get your boosters?" I said, "No, dude, I'm pretty good still. I do not feel like I have to."
So I think that was my point, is maybe you don't need to boost. If it's still in the population, will everybody eventually be exposed to it and get natural immunity or something?
Yeah, potentially, but there's definitely data, and there's some recent couple of publications that came out. One out of Kentucky recently, comparing everybody that had natural infection, put one group in the vaccinated pile, put another group in the unvaccinated pile. The unvaccinated group, I think odds is 3 or 4 times greater to have another infection. Another study just came out this week, it's similar type of finding. If you're kind of in this natural infection group and didn't get vaccinated, you're more likely to get it. So I think it's coming to show that vaccination is better than natural infection.
And I'll speak personally. I had COVID twice and I've been vaccinated. So I had COVID last year, August. No real symptoms, random in terms of how I got tested. And did my 14 days, got tested again, I was negative. Then I went to the Wild Wild West. Does anyone know where the Wild Wild West of COVID restrictions are in our region?
France?
St. Charles County, right. I went across that water, right? I went across Missouri River, met my cousin, walked into Bar Louie's, and I said, "What in the hell have I done?" Because there was no social distancing, masks weren't worn either. And 3 days later, I had chills, fever, etc. No respiratory issues, but certainly I felt it for like 6 days. So I had it twice. That was latter November, so 1st August and latter November. Then I got vaccinated as soon as it was available. So how do we get past this? Yes, vaccinations are key, but how do you penetrate and convince folks, right? And then also, how do we reconcile challenges within our system that have been alluded to earlier that continue to plague us around meeting the needs of the most vulnerable? And so that's a very complicated mix. And so in the work that I do on a daily basis, it's really covering everyone from youth on up to seniors who fall into that spectrum. These are folks who are not commonly connected to health systems either, which is a whole nother element of this, right? Because trust is delivered in a variety of ways, but for those who are connected to a medical practitioner, that often is a mechanism. There can also be ways in which people are connected, where they have others in the community that they trust, family members, etc. And so when we're thinking about, let's say, also transient populations, isn't it amazing how we talked earlier about stay-at-place orders and home mattering, right? Home matters, right? So if you have a whole significant group of your population who also, separate and aside from actual infection of the virus, have lost their jobs, their livelihoods, they are also potentially being displaced from their residence. That's why those moratoria on housing evictions were important, because the more transient you are, the less you have control of your environmental factors, and therefore it increases the likelihood that you could be infected. So these are some of the pieces that we also are working on with the distribution of nearly $60 million in the county of rental assistance dollars and about $30 million in the city of St. Louis. And at the state level, another $325 million of rental assistance. It's important to keep people in their places, both for the virus, for overall well-being. How many folks have seen news reports that speak to the level of depression, suicides, domestic violence, all going up during the pandemic? All of those things are compounded when you don't have a sense of control over your life, your well-being, stress. Anybody in here married? You all look like a married couple. Right? You're married. You're married. Oh, so many people married. So
Not a lot of young folks married yet. So I guess it's the educated generation, right? You delay marriage, which is good. But with all that being said, when finances get tight, stress goes up, oftentimes in relationships, even the best of them. And that can impact households. And so I think what I try to do in our work and really motivating the continuum, the broad group of folks who service those in this space, is to really understand individual and family circumstances, so that you can really understand not just why they're telling you they're resistant to potentially getting vaccinated, or why, but you have to kind of understand and meet where they are. Find them in the community. I'll give you another example. For those who are unhoused in particular, if you're bouncing from shelter to shelter, what's the chances of the Pfizer and Moderna second dose being obtained? So these are the sort of practical implementation factors that we have to consider when we're thinking about who are we serving, is first identify and understand whose shoes and what lens are you looking through.
Oh, yes. Oh, thanks. Thank you so much. Thank you guys so much for really, really great answers, and hopefully everyone's thinking about what they're saying, so please ask questions. So thanks. Oh?
So kind of going back to this misinformation versus disinformation, in your opinion, to what extent do you feel like current vaccine educational outreach efforts are more putting information into this giant pool of both credible and discreditable information, rather than trying to address like the source of misinformation, disinformation? And to what extent would you like to see the the approaches to current vaccine outreach education efforts changed, if so?
I would like to be informed myself. I'm learning the hard way. Some of these social medias I'm just learning the mis and disinformation. It is very huge. And so just learning what's out there. I'm not sure how we can find out what people know and what they don't know until we face them face to face and they're in those positions. So how do we, as a community, learn what's being communicated? How do we track it? How do we keep up with it? And then we can respond to it. And for me, the response is based on what social media platform are people on. Just imagine video games and persons talking and giving out disinformation. How do we educate those persons when most of the gamers don't even come outside? So how do we reach them? They're not on radio, TV. So how do we do those type of things to educate them before it's too late? And so for me, being a seasoned person, I would say this, but seasoned, what's happening out there? They're spreading this disinformation other than Fox News and other medias. It's bigger than that. I'm learning that it is bigger than that. And how do we become educated about that misinformation?
I completely agree, and here's the problem. People who have, and I don't like the vaccine hesitant. At this point, frankly, and I'm going to be really hardcore, at this point you're an anti-vaxxer. You're anti-vaccine because we have had billions of people on this planet safely vaccinated with frightfully small numbers of safety issues. The problem is that people that don't know, they're on the fence, are going to go to the news sources they trust, which almost always in this generation turns out to be social media. And that's not an objective news source. They're not going to do what you all are doing here and listen to, well, here are the pluses and here are the minuses. Unfortunately, there was a great book that was published in about 2014 called The Death of Expertise that predicted all of this. That said that we're relying on social media and immediately all becoming experts on every subject ever because we can find out the answer in 30 seconds on Facebook. But what we're not realizing is that Facebook information is not, as we in the scientific world say, is peer reviewed. And so I think that we fundamentally have to rethink about where we get our information from. There is a big question out there as to should there be more rigorous safeguards put on Facebook and other social media companies. And I think it's a fair question.
Just, do you think it starts really at the educational level, like training students from a young age to not believe everything they see on the internet? Because obviously the internet has really kind of exploded as I grew up and everything, right? And it's become this phenomenon. It's like, yeah, you can't find anything you want to know on the internet. So do you think there's like a lack in your educational training as like a millennial to really be critical of the things that you see online and think about this stuff more seriously?
My personal opinion is it has to start with humility. It has to start with us accepting that we don't know the answers. And when we don't know the answers to something, we need to find out. Rather than an immediate presumption that we know the answers to everything. And one of the things about a scientist is that scientists can always say, I know up to a certain point and then I'm not sure. And that is oftentimes by anti-science people used against them because, well, you don't have, you even admit you don't know. That's how the scientific process works, and it's hard to communicate that. I used to teach at Johns Hopkins a course on communicating science, and I would start off the class by asking, are eggs safe to eat? Are they good for you or bad for you? And then we would have an argument that would invariably go on for about an hour until I would stop it. And basically the reason is because there's some evidence to say yes, there's some evidence to say no. People don't want that. They want the black and white, and they don't realize that there's a gray. And that's created, I think, problems, that we go to the black and the white. Sorry, honestly.
One other issue I think too is online, you could find a doctor to basically say whatever it is you want to be said. So they pretend to be an expert, but it's really what's important is consensus.
Yep.
So if the medical community has a consensus that you should wear a mask or get immunized, that's more likely to be the right answer, not what any random expert online says, but they get amplified online because they may have the biggest platform, or they may be saying the most outlandish things, so they draw traffic. So this is again where I think there has to be some kind of quality control on information, and I hate to say it like that, but if the water has toxin in it, you're supposed to not drink it or be warned, right? Or the food is contaminated, you're supposed to be warned. If the information is contaminated or toxic, there should be a system that says consume at your own risk. This is not, been shown to be safe or accurate information, I guess.
Yeah, but developing something like that is really challenging, right? Like how do you even structurally?
Just look at a newspaper, there are fact checkers, right?
Yeah, but like how do the fact checkers do
But the problem with the social media is the algorithm. So, and because, the way it's structured, because if they're your friend, first of all, you trust them. So whatever story they share, you're gonna believe more than, and then they basically live in a bubble. So the more you like something, then, Facebook algorithm will just gear toward or whatever. So if you like Trump, within like a day, they gear toward like QAnon or something like that. So it's algorithms driven to drive people to live in a bubble. So how do you break that bubble instead of they're going out to reach something? So, there has to be some regulation, otherwise they keep.
Real quick story, less than 10 seconds. Don't even need a microphone. I was taking an Uber, and the person, I was wearing this, and we got into what I do for a living, and he said, I just heard this thing with an attorney who was going on and on about how the vaccines have killed hundreds of thousands of people, and we can talk about that if you're interested. And he said, why would he say that? And I looked at him and I said, because he's trying to make money. And the driver, who was a very nice, articulate, bright guy, was stopped cold. And he said, I never thought of that. And to me, that's the most naive thing in the world, because you've got an attorney, and none of us trust attorneys, sorry if you're in the law school. But that is so fundamental. But why did it not dawn on this person that there was an ulterior motive?
Right.
And I think we've lost that humility, and we've lost that questioning all at the same time. And we need to have our humility back to know that we don't know the answers and question the things that are too easy.
But you have exposure to question.
Mm-hmm.
And those lower income communities, they don't have exposure.
Good point.
They just don't have exposure. The anti-vaccination, some of these young generations don't even know anything about a previous vaccine mandate. They don't even realize they've been vaccinated.
Right.
So that misinformation comes with education,
Good point.
but spreading education. So in hearing that, they do not know because their circle is so small. They live in pots. I have some employees who never left 3-block radius. this is the environment so they only know what the 3 blocks, then the pandemic just threw them on social media. So then they were just traumatized by everything they learned at one time. So hearing that part, how do we even educate them about the many years of vaccine mandate? And I was glad to hear that this anti-vaccination pushback is coming. Don't freak out about it, don't be mad at but so that's good to even know, so that the person who's anti realize you really not in a group that you're starting something, this is normal, and then maybe they won't be anti anymore. So, but they circle is, they just don't know.
Small universe.
Small universe.
Yeah, I mean, I think the word that you use that I often think about when speaking to students, thinking about what's probably one of the most valuable skill sets that you can have as a person that's growing is to think critically. You can get an education any number of places. You cannot be educated if you're not a critical thinker. To me, you're not going to be able to move beyond where you are, and you're not going to be able to be a problem solver. And so when I think about to the question around how do we get past this, how do we deal with some of the things that have already been mentioned, part of it is also a stop operating in our silos. So each one of our bodies, organizations, any number of the layers of bureaucracy that we have throughout our systems has access to somebody. But we don't co-brand, we don't collaborate in ways that could really contribute to collective impact. That to me is really the answer, because then you have a multiplying effect. So I'll give you an example. Some of the things that we've been doing around rental assistance, the same folks that need rental assistance are the same folks that are not vaccinated at a high level. The same folks that are impoverished, same folks in concentrated areas where school systems aren't doing well. Right? So if you understand the commonalities of the population you're trying to serve, then you co-brand, you co-link many of your messaging so that you can hit them. Maybe they didn't get it this way, but maybe they'll get it that way. And you never stop it. It's just like a smoker. How many times does it take a smoker to stop smoking, right? To try to stop smoking, it takes them about 7 times to stop, right? Before they're successful. The same thing when it comes to this vaccine conversation. You have to continue to beat the bushes. It's not going to be a one-off conversation. We have to figure out ways that we can use all of the available access points that each and every one of us individually and organizationally may share to reach folks.
Yeah, look, social media is here. I don't think it's going away. I've never been on TikTok, but I have 3 children and teenagers and in college, and they're on TikTok, and someone says, oh yeah, the other day TikTok said that if I get the vaccine and then I'm going to get COVID, I'm going to give it to people. I'm like, that's something on there, really? Reality is, I probably need to be doing more talking to you guys about how to make some messages and some of the stuff we're thinking of. And I think it goes back to trusted messengers throughout these different groups. Everybody has them. You know, my story, so one of my favorite things to do is to go pick up saliva tests for COVID-19 with one of our projects. So I go to houses, and I'll go all over. So I've traveled to St. Louis. I went to this one wonderful senior person, not like you, who said, I asked her, I said, are you vaccinated? She goes, no, I'm not vaccinated. I said, well, why aren't you vaccinated? She goes, I'm just scared. Just scared. No one's talked to her really about it. She's the matriarch of this family, no doubt. And I think, you know, like you said, it's not one conversation, right? I'm like, you gotta keep having the conversations. Oh, she's just scared. And I think there's more of that than we probably realize. And I do, but back to, I think that, I wish there'd be regulation for social media. I wish there'd be all these things. I just don't think it's gonna happen. So the question is, how do you leverage it to make it work? Because we're always gonna be fighting it. But can we utilize you guys as young people? Because I don't know, I need you to tell my sophomore in college son over TikTok that'll fight him with all of his other college buddies who are telling him some really dumb things that might prevent him from getting vaccinated. He is vaccinated though, by the way. He got Johnson & Johnson, thankfully. It was easy.
I mean, social media, money talks. So if you pay they're gonna send the feed to, so you can select who it's sent to. So select anti-vax, all that stuff, and then, create an ad that appeal to them, but somehow convince them to get vaccinated. So if you pour a whole bunch of money into it and send a whole bunch of ads, against them, it might work, unless there's some regulation, but there has to be some regulation though. Because all they do is flag, recent, whistleblower exposed, right? They chose money over anything, so they just, whatever, get more engagement out of it, if it brings them money, they're just push it forward. But there was a conscious decision made by the executive team. So, if you're gonna fight that, if they choose money, you have to pour money into, anti-vaccine movement in a way. We have to penetrate, otherwise they're gonna live in their social bubble, we'll never get inside,
Can I ask you a question? Humility. Right now, as the CEO and also a person in North St. Louis, do I get the booster? When I get the booster? Do I wait 6 months? Do I work 3 months? CDC said yes, Biden said no. The humility of saying I don't know and just saying it. So when I heard you say Johnson & Johnson, oh my God, it took us so long to get people back just comfortable with being vaccinated. But just telling the truth, when do you get the booster? So many people now are being reinfected. And so they said 8 months, 6 months, it may be 3 months. Tell the truth. So that type of misinformation causes trust. What do you think about that?
Oh boy. Okay. As an immunologist and as a scientist, and the beauty of you get 2 scientists in a room and you get 3 opinions, always default to the Centers for Disease Control because they generally have the public's interest at heart. They didn't a few years ago, but somehow in January they started getting it back again. And I say that, by the way, as I belong to neither party, and frankly, anti-vaccine is not black and white populations, it's not conservative or liberal, it's all of them. It's the one thing that unifies everybody, because it's extreme right and extreme left that are both equally vaccine hesitant or anti-vax. It is, every population has this. Okay, getting to the question of, from a biology standpoint, what we now know is, and this is the most, I think, misunderstood thing about the vaccine in my opinion, the vaccines were not meant, they were not created or designed to prevent you from becoming infected. They were designed to prevent you from having severe disease or, Lord forbid, dying. So your likelihood of being infected is there. Coronaviruses are amazingly quick. They are amazingly resistant to vaccination. 1 time out of 6 on average that we get a cold, it's from a coronavirus. We can get infected with that exact same coronavirus roughly 6 to 12 months later. Same one. We had immunity for 6 months. It's reasonable to expect the same sort of thing is happening here. Do we need the 3rd boost? Full disclosure, I'm on the Moderna trial. And so I just got my 3rd boost Wednesday.
Here's a booster card too. Sweet.
There you go. And so they're drawing blood from me all the time because they're using me as a dummy for one of their cardiovascular things for the vaccine. Do we need that 3rd shot? As an immunologist, probably not. One of the things that I'm frustrated with is people talk about titers as if this is something that people understand. A titer just means the amount of, or it's a correlation for the amount of antibody in your blood. Over time, it will drop because your immune system is doing other things. You don't want it to be at high titer because if everything that you would get exposed to caused a high titer, you'd soon have your blood coagulated with antibodies. So it's natural for it to drop, but the vaccine allows you to make more antibody on demand. So we've heard stories about, oh my God, my titers are dropping, I must be susceptible. No. I think personally the 3rd shot to me as an immunologist is a feel-good shot. It's probably not biologically necessary. We'll know more about that in the future. That's one of the things, frankly, I don't think we know, and I think it was an easy, frankly, cheap answer. But that being said, I will let somebody else talk.
Yeah, no, I think, this is where this is, this is what, the point being is, I think, because science has these unanswered questions, and, Dr. Walensky, the head of the CDC, came up against this, do I need to do this or not, and thinking of the societal piece of where it is, there was data out of Israel that suggested this third dose. A couple of papers had really demonstrated a continued reduction in numbers, but really going after infections, which I think gets to this point that we've actually asked the vaccine to do more than it's intended to do. Because, look, if you look in our hospitals right now, thankfully the cases are down, 95% are still unvaccinated. That's the story. Now, the other thing to keep in mind to separate out is there's the booster for like someone like me, but then there's, my parents who are over 70 that, that could be boosted, that may make a difference because we definitely know that the booster for the elderly, that we have seen them in the hospital after 2 doses. So, and then the last thing is if you're immunocompromised. The reality was if you're immunocompromised, you needed 3 doses. It wasn't a booster then. It was you need 3 doses, which is what Johnson & Johnson's going to become. The reality is your primary series should be 2 doses. But with all that being said, that's confusing, right? And that's confusing for me who lives in this, who basically mix, match vaccines. I do this all the time. So you can see how this gets confusing, especially with something so, in the forefront of all of our thoughts. And I think you had a question, but you want to respond?
No, I was just saying, and people assume that they don't know what they're talking about. And it's not that we don't know what we're talking about, it's what's the best. When you're talking about immunizing 7 billion people, is it appropriate for Americans to be getting the 3rd shot before other people get their 1st? And that's part of this equation as well. Does the 3rd shot cause any damage whatsoever? No, to the person being vaccinated. Does it mean that maybe someone in sub-Saharan Africa is not getting access to a vaccine? Yes. And I personally, ethically, have a problem with that. The only reason I got my 3rd dose is because otherwise I fall out of the trial, and I don't want to have my data point taken out of the trial because I volunteered to be a volunteer. Whoever, I'm sorry.
Yes.
I have a quick question. You mentioned that the resistance is common. I've always been curious as to what happened previously to get us past that. So why are we doing it, or will we get there?
Okay. So,
Yeah, let's go. I can't wait to hear this one.
So the first vaccine was quite literally a vaccine. It was made with cow. It was for smallpox. It came out in the 1790s, and basically the only people that took it were Napoleon's army, because he realized the strategic advantage. In Britain, they had to mandate it. And when they mandated it in the 1840s, there were riots. I mean, entire cities were burned to the ground in Britain. They basically had to bring out the police and say, you're doing this. And eventually, as more and more people realized, because they quite literally thought you would turn into a cow, because it was a cowpox vaccine that was preventing smallpox. They literally and sincerely, this wasn't like crazy people, thought you were going to turn into a cow. So but as more and more people around them became vaccinated, they realized, oh, this isn't so bad. Every single vaccine has had the same issue. And I can go on and on with examples of each. But the degree of lunacy by the anti-vax community, frankly, is out of control. The most recent controversy, other than MMR, and that's a whole hour itself, was Gardasil. We can prevent 2 or 3 major forms of cancer.
Cancer.
Yeah.
Cancer, by the way. Yes.
And it was attacked because they said it's a promiscuity vaccine, because those cancers are caused by a virus that causes infectious diseases. And they said that as soon as you if you introduce Gardasil into the population, teenagers are going to lose their fear of sex and have sex all the time. Now, when I was a teenager, I can tell you on Friday and Saturday nights with hormones raging, I wasn't thinking about the human papillomavirus. And I'm guessing not many teenagers are. But that's the degree of irrationality that this illogically gets named. So the short answer to your question is, as other people become vaccinated and they turn out fine, you suddenly go, yeah, I guess, my cousin got it and they were okay, so I'm going to get it too. And that's where I was very optimistic until about a month ago, because our numbers have just flatlined. And I think that we have now a population of people, the person who says, or the woman that you saw who said, I just don't know and I'm scared, those are the people we need to get to. But the people that have already made up their mind, this is a religious conviction. This is akin to that degree of belief. That's going to be hard to break through without just saying, you know what, you can't go to a grocery store. And unfortunately, mandates are hard, but they save lives.
Yeah, I have a question. So as healthcare professionals, how do you go about addressing some of the fears that people have about the vaccine that have to do with the historical legacies of medical experimentation and things like the Tuskegee syphilis study?
I swear I will stop talking. In my book, I wrote about Tuskegee in 2017, and I actually anticipated that what happened was going to happen, which I wish I weren't writing. Tuskegee, frankly, was abhorrent. I teach a class down the street in the School of Medicine, and I put Tuskegee up against what the Nazis did and what the Japanese did in the Second World War. And I put all three of those people that were responsible for that side by side by side. And the bad news that just keeps getting worse is that more people remember the experiments at Tuskegee than the Tuskegee Airmen or the incredible institution that's in Tuskegee. And what we have to do is to explain to people that we don't do that anymore. And people can say, yeah, right, maybe in your neighborhood, but in my neighborhood they do. And we just, again, I think the only way to get through is to penetrate each and every community. Who are the thought leaders, the trusted thought leaders? Have deep conversations with them, answer every question, tell them again what you know and what you don't know. And if you can sway them, then they can act as the role model for others. But Tuskegee is out there. It is, I would argue, as bad as what Mengele did, what Ichi, if you're familiar with the Japanese situation in China, and I can't think of his name all of a sudden, who did the Tuskegee experiments. I put them in the same pile. We have to undo that damage. And that's why, frankly, I volunteered for a trial, because I can't preach to someone else. I mean, I started a year and a half ago when I didn't know what I was going to get, if it was going to be good, bad, or ugly. And that's the only way I feel like I can now get up and say that. Otherwise, I'm just being a hypocrite.
We'll follow up.
Yeah, I think this is where messaging matters, because I think oftentimes we can want to kind of segregate folks into you're foolish versus you're informed, you're enlightened versus you're stupid, right? I think messaging matters in recognition that people's position, however different from your own, may have some trail of validity to it, right? And I think that's the only way you can open up the dialogue that's necessary to really get to that next step. And I think the other piece is to recognize the data. So early in the pandemic, testing was not as widely available, particularly in areas where people of color were most impacted. Death rates were higher in areas for people of color. And these things still reverberate to this day. We have an asthma level here in the city of St. Louis, which is horrible, right? Young children, etc. And many of them still as adults have respiratory or other related issues. How many dialysis centers do you see in the black community, right? And they are immunocompromised, right? Last time I checked, there was a disproportionate number of African Americans who also are infected with HIV.
Yes.
So I don't need to run down these obviously and well-known data points to many folks, right, in the community, right? Many folks in those very communities know this. Right? And so the question becomes, well, then what are we going to do about it, right? Because we can, I hate going to seminars where someone, particularly someone who does not look like me, is not impacted in the same way my community is spitting off all of the negative statistical data about my community without, in that dialogue, having any sort of solution-oriented pieces to it, right? And so I think that is where you clue in, right, is to be relatable. That's also a reason why I think it's important for more African Americans to be in medical school, to be physicians, to be other health practitioners. Because let's also tail back this to a study that came out, I think, just shortly before the pandemic, where they evaluated physicians prescribing of pain medications and the idea that African Americans didn't feel pain in the same way that Caucasians did. And this was, right, this wasn't uneducated people who thought this, these were physicians, right? So we have a sort of racial undertone that is throughout our entire system, right? So again, I keep going back to this idea of understand who are you serving and the lens through which you should be looking, right? And not condemning people because they have different beliefs. I don't, you know, you'll find, when I was in med school, coming from St. Louis, I'm going to undergrad in New Orleans. New Orleans is a city of haves and have-nots, so I spent quite a bit of time there. Then I come back to St. Louis, but you know, your perspective is interesting here because it's segregated. Right? You have certain ideas about what white folks are, what black folks are, what Asian folks are. We didn't have that many Hispanics, but now we're growing a Hispanic population here. And so, you know, I went there and I was doing some of my 3rd and 4th year rotations, and I'm seeing the Amish community. And they're strongly anti-vaccine as well, right? And so you start to learn a little something about things beyond your 3-block bubble, right? And I think that's part of our challenge really during this time, is to get outside of this narrow way of thinking. If we're going to impact change, we have to sort of lend an olive branch, communicate with people about the challenges, but not stay there all the time, but always have that as a reference point so that when you come into conversation with folks, you aren't, you know, stepping on those landmines and insulting people, because that's the quickest way you can end a conversation, is by saying something that is insulting. And so that would be my piece on that, is to recognize the challenges that already exist. Oftentimes we get caught up in emotion. A lot of these decisions are based on emotion, right? Not based on data. But if you can connect the dots between things that they really care about, that they do know and they do account for, with where they are now, then I think you can make real inroads.
That's hard to follow. That's awesome. I'll just say, look, as a white privileged male that's sitting up here and blessed to be on this panel, learning from all of you. The one thing that I have learned in this pandemic is that while, you know, I want to be able there to help and be there, having someone that looks like you, knows who you and what you've gone through is paramount. Like, I want to help. I don't know what it's like. I don't know what it's like for you to grow up in St. Louis, to go to Columbia for medical school. I grew up in a town in southwest Oklahoma, went to the University of Oklahoma for med school as a white male. Like, I walk into a hospital, I walk into it, and I'm a doctor no matter what. So it was paramount for us, for me to learn that. And it wasn't easy, right? You come up thinking you can save and do a lot of things, and go, you know, as a doctor, as a white man, I can go help anybody, right? Yeah, gotta do it with the right people. So our team doesn't look like me, and I think the way I can do it is help people like you go into medicine, so that you can come and be sitting here, so that they see you doing this as well, because that's going to be me more, right? Like I actually love my time driving around North County. Like, I can tell you where restaurants are now. I've been to House of Jolliffe. I know where Drake's is. I've been to Red's. I mean, like, and I want to learn more. Right? Because then I can understand a little bit better, but not truly understand without the people that work with me. Like, I was excited to meet you, so like, these are the folks I want to know, so that we can be together to learn. But you guys got to go into medicine, in whatever shape, form, or fashion, because that will help us get past. You don't feel the same pain as I. My pain's whatever. That's crazy. Or in my world of antibiotics, African Americans, Latinos have been shown to be less likely to get antibiotics. Now, that's good. That's not the reason why they didn't get it. Just like a CT scan for a head injury. White folks get a lot more than black folks and people of color. That's good, but it's not the reason why they didn't get it, right? I think that's the problem. Anyway, sorry. Go ahead.
So we've been talking a lot about like very American issues, which I think are very
So it's a whole bunch of little questions. In brief, and I've been saying this since last April of 2020, every chance I can, and that is that this pandemic doesn't end until 7 billion people around the world have been fully vaccinated. And if the United States alone gets vaccinated, and this is why, frankly, I am squeamish about the third vaccine before the poor countries get there first. And meanwhile, they're looking at us going, why are you Americans complaining about, why do you have an anti-vax community? I had a Brazilian graduate student who in 2016, just one of the reasons I wrote my book, went off on me when I talked about the anti-vax movement in one of my classes. And she said, my God, we live with infectious diseases on a daily basis. And she named the number of friends she had, or family members who had chikungunya virus, which is a nasty virus. And so anyway, the rest of the world, this isn't over until we have equitable vaccination everywhere. And I think we're just into a me period, nationwide or probably maybe globally, but certainly in the United States. And we've got to get over ourselves and realize that we can get back all of that pride, all of that goodness that we believe as a nation, I believe in a nation, we're capable of, if we do what we did in the 1950s when we helped eradicate smallpox. Except we need to do it yesterday. We can't wait 20 years, which is what it took to get the smallpox out of here. We need to get everybody vaccinated. And so Moderna and Pfizer and everyone need to be getting temperature stable vaccines and get them around to the world and let them, let the world benefit from that. In addition to all of our other populations here.
Do you think the problems are because they're temperature based or more so just like on the economic side of things as a business?
The vaccine is roughly $19 a dose in the United States for the Moderna vaccine. That doesn't sound bad until you realize that Moderna, though, is selling it for like $500 outside the US. And then suddenly, sub-Saharan countries, Southeast Asia, they're saying, we can't afford that. And there are a group called COVAX, and there are others that are helping out. But frankly, this is where I think the government can step up and say, we're going to do the right thing and get all these people. And frankly, again, I'm going to be on a soapbox. We need to be less selfish. We need to be less selfish in terms of who gets the vaccine, but these things and vaccines are the least selfish thing we can do. What we're doing is we're protecting those immune compromised people. We're protecting those people that are too scared to get vaccinated or that are too sick or old for the immunity to work. That's why this is a selfless thing to do. And we need to be more selfless and less selfish. I think that's unfortunately, we're just into ourselves as a nation, as a country. And I think we need to be not so much into ourselves and think about our neighbor. Okay, another soapbox. So I keep just getting rid of the microphone.
I think we had a moderator. Oh.
So while we're on the topic of that, so everyone, anybody do trick or treating, Halloween related stuff this weekend? No funny dressing up?
I didn't dress up. I hand up.
So my son's Joe. Where did he go?
Yeah, what did he go at?
He went as the sinister jester, so he looked like very demonish. This is the first year like that. But he is 9. He's 9. And so his Halloween joke was, why is Halloween the safest holiday of the year? Because you have to wear masks.
Yeah,
right? And so he was like, Dad, that's an old joke, but all of the old folks giggled. They said he's the best one, and he got him extra candy, so that's just another thing around Halloween.
You guys know the Halloween thing and telling jokes in St. Louis? If you're not from St. Louis.
I've heard about it.
Oh yeah, it's the craziest thing ever. I didn't know this until.
I had forgotten about it, and then I heard it again last Friday.
It's the best, right?
They were like, make them tell this joke.
Oh, okay. I've just been soaking up all of this. You guys have brought up so many really good points. and you guys have hit on a lot of questions I was gonna ask, but I think, I sort of like to direct the sort of narrative, I guess, if you want to call it that, like towards, more towards like underserved populations and also like children. So I guess Dr. Newland, if you'd be willing, and also anyone else can also chime in, just like in general, how can we sort of improve vaccination rates for like children in like schools, and also in like, I mean, we also kind of already hit on sort of like serving lower socioeconomic status individuals and just like healthcare disparities, but if you guys just want to elaborate more on what has been done and what we can do moving forward, that'd be.
Yeah, I'll just talk about from a pediatric standpoint of children. There's no doubt that when we saw the vaccine approval roll out for Pfizer for 12 to 15-year-olds, the vaccination rates were lag behind that of adults. So there's a lot of adults that have said, I'll take on the risk for myself, but I'm not going to put my kids at that risk. There's no doubt that will happen here this week. I mean, we'll see the first surge of probably the first 30% will rush to wherever they can to get their vaccine, and then there'll be another good 20% or so that will be like, I'm not sure, and then there'll be another 10 or 15 or so like, yeah, I'm really not sure. And then you'll have the usual, no way in heck I'm not getting vaccinated. That's going to be a challenge. I think that's, the issue still is always going to be, we're going to have to work on all populations, and it's going to take a lot more work of, individual conversations, talking to the woman I talked to more and more, so making sure she got vaccinated. That's just going to be challenging. But I think you're absolutely right. I mean, I think we have to move to that, which will mean we'll just have to work harder at it. I don't have the best answers of where we do that. I think schools and school nurses are trusted people. The schools we work in, they really trust the school nurse. I mean, and they've been heroes throughout this pandemic. So I think that's a potential way. Schools did help in the first, given vaccines. I think that'll help. There's no doubt ImpactSTL and all the work that FQHCs have done are trusted places from at least I've seen. And I think that we just have to continue all that. I'm also curious about the unhoused. How do you do that? But I don't know, other thoughts from a pediatric standpoint.
One thing we haven't addressed for vaccination is definitely, it's interesting when we talk about pediatric, is the real, another crisis, and I don't know the word they're using, but it's this movement of teachers and nurses resigning and losing our staff, the trauma that has happened during the pandemic. And so for us, we're in 4 school districts, ImpactSTL Health, and just trying to find the staff to vaccinate and even to work and to help us out. When I think about schools and education, just trying to make sure we have enough students in the school system, because we have lost our providers. We have lost our nurses, and we really don't have enough in the education system. But to roll out this vaccination for children, in our executive meeting today, how many nurses do we need to actually help? And we reached out to the temp agency, and they are in the city of St. Louis. They have 300 shortages for the temp agency, and so an LPN, they're charging $100,000. We don't have $100,000 to vaccinate children. This is the crisis that we're facing in North St. Louis, and so it's going to delay the impact. We're not going to get to, even if the vaccines are available, we're dealing with hesitancy, and we're dealing with the staff availability to actually hit that target. So it's a crisis that's facing us, but it's real. This shortage on staff and teachers, and so even for my grandchildren, one child exposed, they sent home for 10 days. In their school system, they don't have virtual learning.
Right, it's gone now.
It's gone. So these children are at home without being educated for 10 days. And so we know the outcome when you fall behind one semester. So the tragedy that we're facing, and I'm glad the vaccinations are there. But how we're going to get them in them children's arms is really, really going to take all of us.
and we should talk after and more, because I think this is, the pediatric community has to come together, to help even, the healthcare system, the large healthcare systems, a colleague of mine is trying to lead the charge of making sure we have different clinics that will pop up and be able to do this, but, we gotta be able to help you guys out too, right? We should be figuring out ways, because we know that the pediatric community will respond, and how do we, set things up to where other people can know, it has to be done. Must be done.
I have a question. Do you have to be an LPN to give an immunization?
No, you can be a
give it
MA.
like students
No.
or volunteers?
And pharmacists.
No,
they're
you
also-
can, pharmacists, MAs, it's a shortage of them all.
Yeah. So pharmacist has been, my wife's a pharmacist, she learned how to do it. She got mad at me because she's like, you can just walk in as a doc, and I had to do 20 hours, and I know more than you. I'm like, yeah, that's true, I'm sorry. But the reality is we need all these folks to come, to set up. And the thing with the children is you have less people wanting to do it. The first, people are scared to vaccinate a 6-year-old. They're just scared. Now look, the needle's going to be shorter. It's not much different. They will sit in someone's. But that is, we run into the barriers even in our healthcare system. It's just crazy. Yes.
I was just gonna say, like, sometimes the people that draw your blood, are they always LPNs too? So is it true that it's not a technician that draws your blood?
There's phlebotomists, and then they have the training to do that. You guys do this.
Something like that where you create a new designation that these are trained, vaccinologists, and then you allow them to get vaccines.
I have a rude awakening for you. There is an extreme shortage of Americans that are willing to work after the pandemic. The trauma is real. And so we have, one of my peers in rural, they shut 150 employees. This is real. And so people are not able to work. The damage from the COVID, the disease itself, we're struggling. We're struggling to get a security guard. We're struggling to get a registration clerk. And some of that is part of just being exhausted with the pandemic. It's a real side effect.
And there's another side of the pandemic and the impact that I think hasn't really been discussed. So I come from a really, really poor part of Appalachia. And my mom was the only person in my family until other than my sister and myself to ever get a college education. She's was a third grade teacher. She's in her 80s and is now retired. Something like 30% of my town's breakfasts and lunch are served at school because they're so poor. When they had to cancel school, those kids didn't eat. And so you're talking about a third of your community that is now malnourished because of the pandemic, because the schools are closed. So you need the schools to be open. Well, the teachers are coming down left, right, and center with infection. Teachers always get infected with everything. The kid walks into the class with sneezing, and you're going to have it by the end of the week. And so you're having a double problem. You got to keep these schools open so these kids can get food, not to mention an education. But the teachers are dropping like flies as well. And those that survive it are saying, I'm not going back into that. So we're going to have a crisis in medical workers, in teachers, and all the people we need the most in this world. And that's going to be a real problem. I think it already is, but I think it's going to become exacerbated.
So this may come up as kind of a strange question initially, but when we're talking about vaccinating underserved communities, or people who may have been laid off from their jobs, I remember earlier you were talking about people who live like paycheck to paycheck or meal to meal. To what extent do you think getting vaccinated is really a priority for these populations? Because you have like all these really serious issues, like families to take care of, so like going out of your way to try to get vaccine information, understand like you guys are talking about, the vaccine sometimes can be really confusing if there's all this information out there. And at the same time you're just trying to maybe find a job, find a place to stay, or find a way to even survive during the pandemic. So like to me it almost seems like the vaccine is something that you can do, but it's really not a priority at all, even though like in the grand scheme of things to get out of the pandemic as a community you should be prioritizing it and wearing masks. So what do you think that plays in the decision for people to get vaccinated or not?
Yeah, I think as your question sort of suggests, what wakes you up in the morning, and it's not necessarily the St. Louis Pandemic Task Force niggas, right? What concerns you when you come home, right? Is it a notice on your door that you're gonna be evicted? Or is it a utility bill that's about to be disconnected, right? Or is it that boss you hate who, you know, is threatening to fire you, right, at the job that you hate, right? You're right, economics, right? We know we're in a capitalistic society. Every time you think about it, even in the political world, say what matters most, right? Economics, right? And so for these households that are struggling just to put food on the table, certainly the pandemic has taught us a lot, right? Food, as was suggested before, is often, I think in St. Louis City, all of the students technically qualify for a free and reduced lunch, right? There are significant school districts in the county that qualify as well. Riverview, Normandy School District, et cetera, also included. And so, yeah, it is not top priority, but that takes us right back to what I mentioned before, why co-branding matters. So take, for instance, back to school events. Folks show up for those, though, right? Vaccine events at those back to school events, right? Rental assistance, we can do vaccines with that as well. That's where that co-messaging matters, right? Because if I can't hit you this way, right, because that's not the primary, I know you need access this way, right? And that's where, again, you can have collective impact through those resources, those messages. Also, we have to understand that all these dollars that have been funded from the federal government, a lot of them tied to certain regulation that tell you can or you can't do this. Many waivers have been granted, but the degree to which you may not be able to message according to this, somebody else can. You can put it on the same flyer. So we were disseminating information also in a somewhat non-conventional place, and that's through the court system. So if you're going to get an eviction notice, you're going to get served, you're going to get messaging about their rental assistance and vaccines, right? So all of these pieces sort of kind of come together, and I think should be layered in the way that we converse about this subject so that we can get to the next step. But I couldn't agree with you more. It's low on the totem pole when you're talking about food, lights, and shelter. Those are the primary pieces of human survival. Vaccines are secondary to those three.
So, sorry, kind of going off that, though, do you feel like the local efforts to co-brand and work as a collective to vaccinate people have been sufficient?
You know, that's a mixed bag. I think there have been some efforts, certainly the regional response team that has come to life. Dr. Jason Purnell has kind of helped to spur that initially. Its work continues. I think it's helped in a couple of ways. One is to center some of the pieces that we're discussing, but it also is important to recognize we've been a very fragmented community for a long time, and the degree to which that has not helped the populations we're speaking to. The regional response team has helped to kind of coalesce groups. My hope is that that continues on into the future. People really recognize based on the data that you can do more by pulling together than you can do individually, right? And then hopefully folks kind of get outside of these needs to have their own ego stroke, whether it's an organization, it's a government, or someone else. And so, yeah, I think there's some pluses that have come out of this, but I think the sad thing about Americans' motivation is often short-term. In the same way that people are responding to social media, they forget about things really quickly when things start going great, right? When seemingly start going great. I thought it was a bit, and I think most people accept that, the idea that you didn't have to show a vaccination, you could take your mask off, it's just an honor system. I think that was totally ridiculous, but that's just me personally, right? Right, and so you just have to kind of be thoughtful, I think, about what you're proposing, what could be the potential impacts of that, and how you can partner. But I think there have been some positives that have come out of this. I tell my old team and I tell my new team, never let a crisis go to waste, right? Because even in the dire of times, there's something to be valuably gained, right?
if you are thinking with that light at the end of the tunnel sort of perspective, right? I think one thing that you learn in medicine, and anybody who's a first responder or crisis-related interventionalist, is that you have to figure out a way to how to box out all the noise and keep your eyes laser focused on solutions, right? Solutions, solutions, solutions. So I speak to any young people here today. If you want to be the best at what you do and what you pursue, and you really want to be valued in the future, be solution-oriented. There are many, many conversations that happen in which people talk in circles. And you have to ask again, did I get a damn thing out of that, right? Right? And you don't want to be in that conversation. You want to be saying, you know what? That was really deep. It made me think. It made me come up with something new. It made me more optimistic about the possibility. So although we know our numbers are here, this is what we're going to do to inch just a little bit closer.
Just one comment. It seems like this idea about the schools providing food to kids, and that's an important way to distribute actually food to families. Also thought maybe that would be a good way to distribute medical care, like vaccines, for example. If you built up the infrastructure associated with public schools, maybe you could feed more people, give them better health care, maybe because it's already there and people already respect it and love it. You wouldn't need to go to a clinic. I mean, these are just like maintenance things like checkups and, wellness visits and all that. If the school provided a nice environment to distribute that, it'd be nice. And then just the other comment was maybe the vaccines work too well. Because I know my dad told me he grew up in Iowa after the Great Depression, and there were kids on his block that were paralyzed by polio. A kid died. He saw people in iron lungs. They got their vaccines because they saw what could happen to you if you didn't. And they had a lot of pressures too. They were poor. They had all kinds of, just day-to-day stresses. But because our vaccines work so well, I think it's easy for people to say, it's not going to happen to me, or not enough people are dying around me for me to take that seriously. And if COVID was 5 times more deadly, maybe that would have changed the whole equation too, because people would have said, we absolutely have to do this. I think right now it's right at that kind of Goldilocks zone where people can kind of ignore it. Say, well, I don't really know anybody that died.
Not for
It's not
us.
true of everybody.
No, that's not true.
Well, it's not true of everyone, but it is true.
Well, for the people who are not vaccinated, and I'm going to just speak of a personal story.
Yeah.
I have a relative who is living with chronic disease, is not vaccinated. She's the mother or grandmother of about 40 people. She has caught COVID 3 times. She is now in ICU. They are still planning a Thanksgiving dinner. One of the cousins have passed away and the little baby's on the ICU, and they still are afraid to get vaccinated. I'm fighting and on, so they see the chronic disease. In school, we are in school at the events passing out the vaccinations. The kids aren't in the schools. The schools just opened them, so we kind of forgot some major crisis. Go to school, don't go to school. There's so many rules. Certain schools open, certain schools close. But for me, it really is this how we give the message and bring the trust, because the misinformation may not be so tragic for some people, but for some people it's everything. And here I am, being a CEO of the health center, trying to convince, this is my first cousin family, and she's only 5 years older than I am. And I'm just in her bed with her, but you may die. You literally, she's diabetic, high blood pressure, all those chronic diseases we talk about. And the misinformation, which is now why they're mad, the first bout of COVID, they said she couldn't get the vaccination for 90 days, so she waited for 90 days, she got the COVID again. So, my goodness, they lied, they told us to wait. So, all this misinformation comes out, and it just continued to bring about fear. And so, as I try to educate how we do that, which is what I meant by humility, it just be, say we don't know, and just tell the truth, and own it when you make a mistake, because it could be deadly for families who believe the misinformation. Because this is a prime example, and I'm still fighting for it. I'm arguing with them every day. actually send a text message, please do not have a get-together Thanksgiving because you all are not vaccinated. But because they told them to not get vaccinated, because they had the COVID, and to do not get the Johnson & Johnson. Now they don't think that the government know what they're talking about, and that they're gonna die anyway. So all this lack of trust is really real. But in some environments, in my work environments, they don't even want to wear masks because they don't have incidents. Exactly like what you're saying, because their family is vaccinated and they're healthier, which is why they don't have the same outcomes and they don't see the same tragedy that somebody else sees. But all of that means something. It all depends on where you are. But some of them see it and they're willing to, and that's sad to say, which is kind of what you're dealing with. They're willing to go ahead and die than to really trust the information. And that's why if the government cannot be the person with the misinformation, they have to get this right because it's deadly for the low-income communities. They cannot say something today and change their mind tomorrow and not own it. They have to own it.
Well, they may have to change their mind as the science develops. They may have to say, well, wear a mask even if you don't feel sick. I mean, I think that's a reasonable response. That science means you have to change your policies. But I think what I would like to find a way is to convince them that the risks associated with COVID are much larger than the risks associated with the vaccine. And that seems like that should be doable. And I don't quite understand it. I know some people say, I don't need the vaccine because I'm not worried about it. But the people that do fear COVID, they know they could die from it. How do you convince them that the vaccine...
I'm trying, sir. I don't have a magic bullet. I'm trying. They're going to put me out the family in a minute, but I'm doing the best I can. I'm really working on it.
Here's a thought. I actually think there's an upside to this last 24 months.
Yeah.
And that is that we remember now what infectious diseases are like, which we've largely forgotten because of vaccination and because of antibiotics. And by the way, we'll give you another one of these on antibiotics. This is gonna sound morbid, but if you look at, I'm a nerd, I'm a consummate nerd. If you look at every American who has ever died in the military, from Lexington and Concord to today, more Americans have died of COVID than all of them combined. World War II, Civil War, both sides of the Civil War, every American combat death, you add it all together and it's just under 700,000 people.
It's 2 or 3 jet airliners falling out of the sky and killing everyone on board every day for months on end.
Right. And I think but people don't realize.
Incomprehensible that we don't do something about it.
We don't have the right prioritization. And then I'll leave you with something else, which is there could be another upside to this, because the vaccine boost in technology, and the paper I published a few years ago showed that we haven't been advancing with vaccines to our capabilities. No one will remember COVID 500 years from now. When you look at history books, HIV/AIDS will be the prominent thing, one of the most prominent things that will be remembered from the 20th and 21st century. We still are losing more humans from HIV/AIDS every year than anything else. And when you look at the numbers adding up over time, so maybe we can utilize some of these technologies, come up with a good AIDS vaccine, HIV vaccine, and now knock this one back in its track. Because when you look at it, we haven't had a big pandemic from a respiratory infectious disease since '68. But HIV is a much bigger pandemic than, I would argue, even Spanish flu. It just hit the wrong part of the world. The people didn't have money. And so we have a chance, I hope and think, maybe using some of these technologies to address that. So that's maybe an upside.
I didn't know that.
So it's,
Well, this 17 for me. I don't know about everybody else, but I'm hungry and I'll pass this on over to the moderator.
Yeah, well, I guess, obviously anything I say is not gonna really chalk up to the amazing discussion that's been going on, but if you guys, sorry to keep you from your dinner for a little longer, but if you guys just wanna each share just some closing remarks, something like a takeaway message for whoever's left, and just maybe even some action items that maybe we can do, or maybe you guys can do with each other, so just final words of inspiration.
I think, we will for sure get through this. but B, hopefully we come out better. We usually do, both from a technology standpoint and other ways. And that way can be that maybe we can get some of this misinformation and disinformation behind us and direct people towards more accurate sources.
Thank you all for having me, and I'm excited about utilizing the students. We need all hands on deck, and the information. So this was really exciting and informative for me. I really enjoyed tonight.
Yeah, thanks everybody, thanks for having me. It's nice meeting you folks. Be kind, promote vaccination, but remember, be kind. I think that we need to remember that more and more as these days get harder and harder.
Yeah, I don't think I could cap off anything further, other than to also recognize that those who are the most vulnerable within our community are being disproportionately impacted. And so as we walk through our lives of privilege and access, I'll always be thinking about them. Holidays are coming up. This month, this is November the 1st, so this is the month for Hunger and Homeless Month, National Homeless and Hunger Month. So there'll be a variety of activities happening throughout the community. So plug in where you can and try to be helpful during this holiday season. They say buy online early now because of low inventory. I say volunteer early during this time as people are in need.